What is going on, guys? I am Miguel from UCGym.com, bringing you the third episode of the Muscle Anatomy series, and today we're discussing the Quadriceps Femoris, which is the muscle group on the front of your thigh. So you can also call this muscle group the quadriceps or simply quads because there are four heads to this muscle. As the name entails, the quad stands for four, ceps stands for heads, and then femoris dictates where the muscle group is located, which is on the femur bone. So I did my best to draw the quadriceps muscles. So you have your vastus lateralis, which this is a diagram of the right leg. So the vastus lateralis is going to be the rightmost muscle group. This is the rectus femoris, which is on top of all the other muscle groups, and it's the one that you see first and foremost if you flex your leg. And then more medial towards the midline of your body, you have the vastus medialis, which is medial to your body. And then beneath the rectus femoris, there's the vastus intermedialis, which, as the name dictates, it's medial or intermedial between the other two vastus muscles. So the origin for the rectus femoris, it's the ilium, which is a part of your pelvic bone, and then it inserts into the tibia, as with the other muscle groups, but the other ones only originate on the femur. So the rectus femoris crosses two joints, meaning that it carries two functions, but it is more prone to injury. So the rectus femoris helps with knee extension and hip flexion. So if you don't know what hip flexion is, it's the same thing as raising your knees upwards or bringing your knees to your chest. That's the motion of hip flexion. And then leg extension is where you just extend your leg, you straighten your leg out. So that's two main functions of the quadriceps. Knee extension and hip flexion. And then injuries. So potential of injury for the quadriceps. So there are multiple injuries you can suffer from your quadriceps, same with any other muscle group or any other body part, but these are the most common ones. I included 4 different types of ligament tears, even though they don't really associate themselves with the muscle groups, but I just included them anyways because they are sort of correlated to the whole knee joint sort of thing. So the 4 ligaments that are in the knee are the ACL, PCL, MCL, and LCL. Now, if you don't know what those mean, the ACL stands for anterior cruciate ligament, the PCL stands for posterior cruciate ligament, and then there's the MCL and LCL, which stand for medial collateral ligament, and the LCL stands for lateral collateral ligament. So these ligaments, they are between the femur and the tibia. So what they do is they prevent the knee joint basically from going too far in any one direction. So these ligaments are sort of in a X and X formation where they prevent the knee from going too far in one direction because they have tension on one side and prevent it from going the other way too far with the tension on the other side. So if you suffer a sudden impact, you can actually tear these ligaments, as is often seen in contact sports like football, or sometimes through basketball when the athletes try to dunk on someone and they land inappropriately. So now on to like the actual muscle and tendon injuries. You can have a quadriceps strain, which is pretty common, where you overuse or put too much stress on the quadricep tendon or your quads in general, and you start getting inflamed tendons and small tendon tears and things of that nature. Next we have quad contusions, which contusion is just a fancy word for a bruise. If you're playing a contact sport like football, again, if somebody is tackling you and they just ram into your quadricep, they can cause a bruise, and a bruise is like a hemorrhage where you suffer internal bleeding and you pretty much rupture or tear a blood vessel and you start squirting blood where it shouldn't be going in your leg, and you prevent blood flow from going to its appropriate designation, and your tissue doesn't get its blood and it dies if it's not treated immediately. And then finally I have quadricep tendon tears, which can happen if you stretch your quadricep too much. So if you fall down and you're sort of falling down where your heels are going to touch your butt in that kind of position with your knees bent, too much of a stretch can cause a tear, and you don't want that to happen. So those are pretty common quadriceps / knee injuries. And then finally I have exercises to train the quadricep muscles. I have compound and isolation exercises, same with the other muscle groups. So for compound, I have squats, which is the best leg exercise there is. We have lunges, and then we have deadlifts. Now, some people will argue that deadlifts aren't necessarily a quadricep exercise, and they're not made specifically for quadriceps, but they do recruit the quadricep muscles depending on your stance, your back position, hip position, knee position, ankle position, your grip, that kind of thing. So a lot of people learn that when you do a deadlift, it shouldn't be the same motion as a squat. You should be slightly more parallel to the ground. You should be pulling with your hamstrings and your extensor muscles of your back, and that kind of thing. But depending on however you grab the bar, there is going to be quadricep recruitment because you do have to straighten out your leg. And then for isolation exercises, there's really only one, and that's just leg extensions. And every gym has this machine where you just sit down, you put your shins against a pad, and you just straighten your legs by raising them. And that's, the best isolation exercise there is, and it's probably because it's the only one that exists, but it is really good nevertheless. And allegedly, different toe positions when you're doing, or toe pointing certain directions, works different heads of the quadricep. So if you point your toes out, allegedly, when you raise it in this direction, you're getting more of a vastus medialis targeting, or the teardrop as bodybuilders and other fitness enthusiasts call it, the teardrop. So you point your toes out, you're getting a slightly different angle of knee extension, and you're targeting more of the vastus medialis. Now if you point your toes inward, you're targeting more of the vastus lateralis, which is the muscle group to the side of your leg, but is part of the quadricep muscle group. So it's the same thing as with calves. If you do a calf raise with your toes pointed out, you're allegedly getting more of a medial head of the gastrocnemius activation, and then if you point your toes inward, you're getting more of a lateral head of the gastrocnemius activation. But it's all up to you and how you feel that the exercise is working for you. And then finally, as opposed to doing a separate video for the hip adductors and abductors, I just throw them in here because they're not necessarily a huge muscle group that really deserves its own video. But so you have the hip abductor, or the adductor, and it originates on the pubis and inserts into the femur. So the adductor is going to be inside, it's going to be pretty much in your groin area, and it's going to insert into the femur. So it's going to be in this general vicinity. And like I said, adduction is when you add a limb to your body or bring it closer to your midline. And then for the hip abductors, the ones that take your limbs away from your body, there is really no found muscle group that has its own name as an abductor. So it's known that the glutes are the body's most powerful abductors, as well as the sartorius muscle, which goes pretty much down here. So the abductor would bring the leg from here out. So the sartorius goes from here and extends over the leg and helps bring the leg out this way for the abduction movement. And then same for the glutes, the gluteus maximus, the gluteus maximus and gluteus minimus, and the gluteus medius. They help with the abduction motion as well. And then there is also a fifth head of the quadricep that people don't know about, and it is called the articularis genius. Now this muscle group is down here at the bottom of the femur. So it's different from the other heads in that the other ones start at the upper head of the femur, like near the trochanter, and insert all the way to the head of the tibia. But the articularis genius, it starts at the bottom of the femur and inserts into the tibia, and is a accessory / prime mover of knee extension. But it does exist, and a lot of people don't know about it. But I didn't even know it existed until I did more research, but it is there and helps with knee extension. And there's really no way to target that muscle group since it is very small and you can't see it. So yeah, so that concludes the video. I'm trying to keep these shorter because the last one was 15 minutes, but nevertheless, yeah. So that concludes quadriceps. There are 4 heads to the quadricep: the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedialis. And yeah, so if you want to see more things like this, head on over to UCGym.com, and yeah.